Hey, hello everyone. Welcome to the COVID Impact 360 Conversations. I'm your host, Larry Cole, and this channel, the hope of this channel is that it's going to be the intersection of COVID and long COVID politics, economies, healthcare, and politics, big time. And science. So today I have Miranda Baxa. And hello, Miranda.
Hello, how are you?
I'm doing very well. You know, um, when I do these types of conversations, I like to try to give some perspective about how you and I met because I think that's a part of this story. Actually, it's an integral part of this story, and it's a good long COVID story. So if you don't mind, I'm just gonna go into how you and I met, and then I want you to give some of your background. So, do you mind if I do that?
Absolutely. It is a good long
So
COVID story.
it is because um, 3 or 4 months ago, I get an email and it was a very official email, and I had to read it 2 or 3 times. And it was from this group called the Economist Impact, and it dealt with it was an invitation to come and sit on an advisory board, a COVID and long COVID advisory board. Um, and I had to read it twice because for some particular reason, my mind went straight to it must be spam. But I did read it again, and then I read the corresponding report that was attached to it, and then I immediately got back in touch with Miranda, I believe, and I wanted to be a part of something like this, and we'll get into why I wanted to be a part of that in a while, because this conversation isn't about me. This is about Miranda. But is that a fair and accurate description of how we met?
It is, definitely. And after we launched the first report, we're really looking for advocacy groups and then also folks who are fully embedded in the research who would be able to provide those perspectives to us for our phase 2. And you seemed like a really good fit. So I am glad, and I'm sure my team is also glad that you didn't think it was spam.
No, and that's really an important function here because I think we're all trying to do something globally. But I'd like to start this way. I would like to hear the early Miranda. I'm going to call it the pre-pandemic Miranda. What did that look like? Schooling? Who are you? Where did you come from? And and then we'll kind of go from there.
Sure. Well, at the time that the pandemic started, I was finishing my master's in public health at Boston University. I was studying health law and policy. And so I came into the official public health scene at a really interesting time when things had definitely heated up. But prior to that, I worked primarily in community-based research. So I have done some studies in, say, harm reduction, where I'm really in the community, working with the community that we're doing the research on and building relationships that way. So I decided to get my master's so I could move more into the policy side of it. My professional interest is really in that intersection between research and politics, and what encourages policymakers to actually implement or at least consider evidence-based policy. So that's the work that I've been doing since then.
So this is a Larry question now. Where were you, or what situation were you in when you thought this pandemic was real? Like this is no longer just stuff hanging in the news. Do you remember what that was all about?
That's a good question. I will say that I was more concerned than others right away when we started hearing about the reports of COVID-19. So maybe in January or February, before it became really emergent globally. And it was
Right.
still kind of concentrated in particular areas because I was fully embedded in the School of Public Health. So I was hearing about it all the time, talking about different ways that we might go about um, trying to mitigate the consequences of this, prevent it from spreading further. And so I remember calling my friends and to say, go to the grocery store, start wearing a mask, those sorts of things. But I was also living in downtown Boston. So it very quickly became kind of a ghost town, where before you would be on the metro and there would be tons of people, and then suddenly it would just be
Yeah.
you and one other person. And so when
Yeah.
that started happening, I think that was really when it started to sink in for a lot of people that this was something very serious that was going to last for a while.
Well, yeah, because that's a very similar story to mine. But how does it transition from I know this is real to I think I'm going to be working in this field? And I know there wasn't a grand master plan the first day that the pandemic became in your consciousness. But how did we get from that day of consciousness to um, COVID or the Economist Impact committee work? Because that's a big leap and a lot of work. So I just like to see that leap. How did that happen?
That's also a good question. It was not a straight path by any means, but I'll give you the important parts. So
Sure.
when I first graduated, I was doing some work with the policy team for a state governor. And then after that, I started working for Economist Impact. And one of my first projects that I was on was related to vaccines, which is a real interest area for me, just about the vaccine
Yeah.
ecosystem in general, how all these pieces, R&D, user acceptance, et cetera,
Yeah.
all really fit together. And I eventually became the research director of that program. And now I work on some COVID-19 related projects as well. But this work with in long COVID really is, we call it phase two. You probably heard me say that at the beginning, but it's
Yeah.
actually more than phase two. We have done a few projects related to COVID-19 in general, looking at the economic consequences, what it means for the labor force, what it means for policy. And then after that work, we began working in long COVID, which has brought us here. But this project that you have participated in came really after we identified some key gaps in not only policy, but in research and even the way we're talking about long COVID globally that make it really difficult to address the condition. So we decided to put together this advisory panel of experts from around the world. I think we have 15 countries that are represented, and a variety of sectors, researchers, patients, advocates, policymakers, in order to come to some consensus about those issues. So hopefully we can find a way forward and make a difference for people living with this condition.
Well, first of all, I didn't realize that you and I share a common interest in vaccines. Now, I say that, but my interest comes from this is a terribly complex conversation. Vaccines all by itself. I have over 9,000 research posts online about vaccines put out by all manner of, so there's probably a whole show just talking about vaccines. But I didn't realize that we shared that common interest. When we got involved in the committee work or in the advisory work to put together this report, um, what did you what was the goals of that? Like to me, there's always there's the hard. This is what we would like to accomplish, and who's the audience going to be for this report? Because it's I see so much, and this is maybe a terrible thing to say on a podcast. I see a lot of word salad put out. There's a lot of great grandiose projects that get put together, and they want to do great things, but there's no execution afterwards. And I just sense something different with this particular committee. I think a lot of that had to do with you, because I'm not sure I even mentioned this. Miranda was our chair. She was the chairman of this committee, so that's why I'm thrilled to have you. Is that she ran all of this? But anyway, going back to the question, who was the audience? Like, what was the goal?
Well, let me first say, I personally, and also Economist Impact, as a group, we do not want to write things that are going to be put on a shelf and just for the sake of doing the research. We very much try to put together actionable recommendations, primarily for policymakers, but for other stakeholders as well, so that we've put the information out there into the hands of people who can actually move the needle on key issues. So our work is in no way limited to vaccines or COVID and long COVID. That's just my primary focus right now. But so with this, the goal, I think, is largely the same: to reach the people who can make these decisions related to long COVID, who can say there are more than 40 definitions in play today. This is not an efficient way to go about research. It's not helpful for diagnosis. We need to decide on one thing. And so we've been able to put some recommendations together for not only how to do that, how to have a universal definition, but also to use the pieces of existing definitions that are helpful to make that consensus easier. So those sorts of things, we really think if we can put out a guiding doctrine, so to speak, for addressing long COVID comprehensively, so not just the definition, but also for policy, for symptom management, for patient support, what are those key things that we can agree on today? And what is it that we can do to make sure that we are supporting patients until we know more? There's obviously still a lot that we don't know. And research will be ongoing, I imagine, for some time. But in the interim, that doesn't mean that we can abandon patients who are feeling the very real impacts of this condition, regardless of whether or not we've been able to make progress from a research perspective.
Oh, 100% on all those comments. Boy, I think of it this way. By the time I upload this session with you onto my channel, your the Economist Impact report will be live and out into the international media. So it'd be fair for me to ask this question now. The committee work is sort of came to an end. And now there's the next phase. And what does that next phase look like?
Sure. Well, the next phase really is about taking the consensus statement on the road, and also the questions that really were the basis for the committee. So those key issues like the definition, symptom management, how best to use the tools that we already have to address this condition. We are doing a series of roundtable discussions at key events. So the first one it will be this week at the time that the podcast is released at the United Nations General Assembly meeting as sort of an offshoot.
Wow.
Yeah, which we're really excited about that. So to bring together more long COVID experts to talk about those things, to talk a little bit about the consensus statement. Now that we have this, what's next? What can we do to put this into action and to make sure that it's effective?
Now I can't not ask this. What's your role in that? Are you going to be chair of that as well?
We have not made any concrete decisions yet, but I've been heavily involved in putting it together. We're really looking forward to it. It should be a great group.
Yeah, because before we started this recording session, I said to Miranda, I said, when you get 15 people in a room, in a Zoom meeting, and you got 15, well, I'm going to say 14 because I can't speak for myself, but I can speak for the people that were in that meeting, really intelligent people, but they have their own sandbox of interest as well. To be able to herd all of that is just a great talent. I'm not blowing wind at you. Like, I'm thinking to myself, I couldn't have chaired that meeting. No way, because that's smart people.
Well, thank you. I appreciate it. You're right. It was a really great group, very, very smart, renowned folks in the world of long COVID. So that made it really easy just to defer to their experience and expertise. And luckily, there really were not too many competing interests or ideas, which is great to see. That made it really easy to put together. But we had some really good discussions. I'm honestly sad that it's coming to an end.
Yes. Like, it's one of those things that as you're sitting there, at least this is the way I felt. You really felt like you're on the inside, like how these people are thinking in terms of their own sandboxes, like their own expertise, and then how that gets shaped into a pie. of a larger conversation, and I don't try to say this lightly at all, but I've been at this since 2019, and that's a long time to be at the advocacy side of this or at the consulting side of this, and we are. This is the most complex situation that science has ever faced when it comes to a virus. And I don't say that lightly because I hang around scientists and I hang around the people that know that this is very complex. So um, I just I'm a big fan of what you're doing. Um, I'm gonna, if you don't mind, I'm gonna transition into I have some rapid fire questions that I like to ask, and
Sure.
um, and it's usually a great way to segue into the last part, and that is so I'm gonna, if you were CEO for the day, you were president for the day, and you could, uh, what would you want to see happen right now? I don't care if it's globally you talk about, locally you talk about, but if you had that power stick, give me an opinion about what's really important to you.
Related to long COVID, I would say I think
Yeah,
the key piece is, or at least a starting point, is the education. Not only public education for people in general, so they know what to look for if they start experiencing long COVID symptoms, but also for others so that
yeah,
they know that this is a thing that exists, and we, need to be mindful moving forward, not only in terms of getting vaccinated, trying to avoid getting COVID-19 in general, but also just being mindful of
right,
other people. But also for physicians, I've heard so many stories about just the realities of medical gaslighting related to long COVID, that there's
yeah,
still a lot of disputes about whether long COVID even exists as an entity. Never mind the fact that there are still disputes about whether or not COVID-19 exists. People still peddling that misinformation. So if we could tackle some of those issues, I think that that would go a long way to give us a basis for addressing the condition in general.
yeah. Yeah, I think you're nailing it because that's close to my heart. Is I believe that you fight misinformation by informing, educating, and
Definitely.
I think that's a big part of it. But I also, you actually touched on one point that you almost robbed me of a question that I like to ask, and that is, what's the single piece of disinformation that
I,
really bugs you the most?
I think it's that. I think it's that people still think, or there are still people who think, that COVID-19 is a hoax, that we went through all of this for nothing. I'm not sure exactly why that is, but I think a lot of the issue with addressing the concerns of those people is that we have not, as a global health community, done a really good job at trying to understand their specific concerns. And we know from a research perspective that the best way to go about that education and to change minds is first to understand what their specific concerns are. Is it we know this from addressing vaccine hesitancy, for example. Is it a safety concern? Is it um, a religious situation? What is it that makes people think this way about it, so that we can counter those particular things with facts and information? They're still, when it comes to vaccines, for instance, still welcome to make their own decisions. But with something established like COVID-19, which has taken millions of lives globally, it still impacts people, will continue to be a condition that we have to contend with. um, I think we need to make some headway on those pieces, making sure that we can at least agree that this is a very real threat that needs to be addressed.
Boy, I agree with all those points and then some, because my personal goals is, how do we take a complex problem and be able to explain it at a grade 7 level? And that's not condescending. I actually mean that. I say that very often in the boardroom. We need to be able to speak plainly and to be understood. And I think that's a big part of it as well. That my personal pet peeve is what I call malinformation, malicious information. information that costs lives. I had to sit and watch thousands of videos of people in ICUs dying, saying, I wish I hadn't listened. Families, young men, young ladies. So that's my own particular one, is malicious misinformation. So anyway, I'll get off that topipic because that's a very deep one. It gets you, it's kind of negative, but it's
That's
part of
okay.
it's part
I'm
of the
here
slick
for it.
though. Yeah.
Yeah.
So now, what's your favorite beverage?
My favorite beverage. I love a latte. We'll go
Okay.
with that.
There's no right or wrong. What's your favorite car?
I always wanted a Cadillac CTS when I was younger. I do not have one. I have since purchased a car. I did not buy it, but that will be my answer for that one.
That's on the list.
Yeah.
So, dog, cat, both, or none?
Cat, definitely cat.
Oh, a cat woman.
Yes.
Good. See, I'm both.
I am a
So,
fan. Okay. I respect it. I respect it.
who's, and it doesn't have to be somebody we all know, but who was impactful in your life?
There have
I
been
know.
a lot of people who
Sure.
were really impactful in my life. I had a professor when I was doing um, my bachelor's, actually, who really made a huge difference, I think, in my career trajectory and my educational plans and all of that, who was really good at explaining the concepts of public health. And one of the things that always struck me about this work is that it's not enough to just know that something is happening. We need to know why. What are the things that make people at risk? What are the things that are contributing education wise, et cetera, those risk factors or social determinants of health and how they make a difference. And I think those conversations with her really, really kind of pointed me on the path that I'm on now.
Because I'm a big fan of having mentors in my life. They could be business mentors, they could be personal mentors, but I'm just a big fan of that. And I know that I've had some impactful people in my life. So I like to ask that question because everybody typically has somebody that kind of sent you to your North Star. And I know it's always a group, but anyway. Um, so any last thoughts? Anything
Any
about this
last
entire
thoughts?
topic? Any last thoughts?
Well,
And there's no right or wrong.
that's good. That's good. I definitely want to thank you again for
Oh,
participating.
yeah.
It was really, really great to have you. For any of our other experts that are listening in, thank you to you as well. We're really proud of this work we put together, and we're hoping that it will be used kind of as a roadmap for addressing long COVID. And so I encourage anyone watching to read it. It's not too long of a document. And hopefully it'll point us all on the path forward to making a meaningful impact in addressing this condition.
Oh, for sure. Yeah, well said. I thank you, Miranda. You didn't have to do this, and that you signed up right away, and I'll tell you, I'm thrilled. So
Me too.
we'll say our goodbyes, and until the next time, and maybe I'll see you at one of the roundtables.
Absolutely. Thank you so much for having me.
You're welcome. Bye bye.